Did you know that you are up to 91% more likely to die if you are obese or overweight? With the new evidence coming into picture, it is necessary to talk about the health issues caused by obesity. Obesity is one of the biggest reasons for death in recent decades. According to the World Health Organization, about 2.8 million people die each year due to obesity. In this video, let's talk about 10 health issues caused by obesity and weight gain, both the deadly ones and the ones you didn't know were caused by weight gain. Cancers. You heard that right. Having higher fat content means that there is a higher chance of contracting 13 or more types of cancers. You are 7 times more likely to contract type 1 endometrial cancer if you're severely obese, and 4.8 times more likely to contract esophageal adenocarcinoma, and these are just the high flyers. One of the things they tell you in medicine is prevention is better than cure, and that certainly holds true for a disease like cancer. If you are obese, regular health checkups can potentially help you stay safe. Cardiovascular disease. This is not a surprise to anyone, but obesity increases the risk of cardiovascular diseases. These include coronary artery disease, congestive heart failure, heart attack, and stroke. Heart diseases are extremely scary due to the lethality involved. Higher fat content and LDL cholesterol levels in the body result in a thin layer of fat building inside your arteries called plaque. This layer can increase in size if the fat levels are not reduced and can lead to atherosclerosis. You can think of this in simple plumbing terms. If the salts in the water pipes are not cleaned often, it blocks the water flow and can lead to a leak or a burst. Unfortunately, it can be hard to diagnose atherosclerosis until an artery becomes so thin that it can't send enough blood through. It's important to consult a doctor soon if you notice any of the symptoms of atherosclerosis, as early diagnosis and treatment can prevent a future stroke. Type 2 diabetes. Type 2 diabetes happens when your body becomes unable to use insulin properly. It is a chronic condition caused by hyperglycemia, or consistently increased sugar levels in the blood. As per clevelandclinic.org, researchers estimate that about 6.3% of the world's population suffers from type 2 diabetes. It is one of the most well-known issues caused by obesity and weight gain. Being obese and having higher than recommended fat content in the body leads to insulin resistance, where the body is not able to utilize insulin effectively. There are a lot of papers going into depth on how increased fat levels lead to insulin resistance, but the popular theory is that adipose inflammation is what causes this insulin resistance, as the adipose tissue produces pro-inflammatory cytokines that directly lead to insulin resistance. Type 2 diabetes, if untreated, can lead to severe issues such as cardiovascular diseases, kidney failure, and even death. While diabetes cannot be reversed, it can be controlled with lifestyle changes and medication, which mostly include eating healthier foods, getting the recommended amount of exercise, etc. Non-alcoholic fatty liver disease, or NAFLD. NAFLD is a very concerning issue that I feel is not discussed enough in videos talking about health issues due to obesity and weight gain. This disease occurs when there is too much fat buildup in the liver, even when the person does not drink or drinks very little alcohol. The issue with non-alcoholic fatty liver disease is it's hard to detect since there are no early symptoms that appear. Some of the usual symptoms are fatigue and pain in the upper right belly area. However, as this disease is prevalent among the obese, it can be hard to diagnose without a liver function test. If the fatty buildup continues, The disease can worsen and lead to cirrhosis or severe scarring and even liver cancer. While this disease is more common in the older population aged over 50, we have been seeing more and more cases of the younger population suffering with this disease as a result of obesity. Spreading awareness on this issue can help people identify the severity of obesity and take steps to prevent or reduce weight gain. Gout. Gout, or as I call it, my worst nightmare, is one of the common issues in those with obesity. It is a type of arthritis that causes uric acid crystals to build up in joints. It is caused by eating foods with high purine content like red meat, anchovies, liver, etc. Spinach also has a high purine content, but purine from spinach is not thought to cause gout. I can personally attest to the fact that gout is painful. It was the most pain I have ever experienced in my entire life, and I am not embarrassed to say that it brought tears to my eyes. Other than obesity, you can also get gout genetically. When I had my gout, my diet included mostly white meat and almost no red meat or any other food with a high purine content. But I have since eliminated all red meat in fear of gout. I would rather watch the Emoji Movie on repeat than face gout again. Sleep apnea. Sleep apnea is caused when your upper respiratory tract closes during sleep. This can lead to irregular breathing during sleeping or even complete pauses in breathing. People with obesity facing this issue often report feeling tired and sleepless. The lack of enough sleep, however, also leads to more weight gain, which can worsen the symptoms of sleep apnea. Untreated, sleep apnea can lead to cardiovascular issues. It is a destructive cycle that needs to be stopped before it finishes spinning. Chronic kidney disease. In a paper published in Canadian Journal of Kidney Health and Disease, the authors state that weight gain alone may not be sufficient for causing chronic kidney disease. However, they do note that there are also effects of adiposity that could affect the kidneys directly, induced by the endocrine activity of the adipose tissue. The activity of the adipose tissue can lead to pathologic changes in the kidneys that could underlie the higher risk of CKD that was seen in some observational studies. Asthma. Obesity can cause or worsen the symptoms of asthma in many individuals. When I was obese a couple of years ago, I had to use an inhaler after doing any strenuous physical activity. Arthritis. The connection between obesity and arthritis is a fairly simple one. Increased weight puts more pressure on the joints. The risk of getting arthritis is 4 times higher in overweight women and 5 times higher in overweight men, according to the Johns Hopkins Arthritis Center. The report goes on to state that even small weight loss can help a lot with arthritis, especially osteoarthritis of the knees, and can decrease the pain immensely. Dementia and Alzheimer's. Increased levels of leptin are found in people with a high body mass index. Research suggests that leptin may be the link between obesity and dementia through the development of inflammation. If you like this video, please share and subscribe. As a new channel, any little interaction helps us keep making the content we love. This concludes our series on obesity. In the next series, we'll explore ADHD and the effect it has on people living with ADHD. Don't forget to drink some water. See ya!